Did you know that hormone levels can decline as early as in your 30s? Hi, I'm Erin Miles. I'm one of the nurse practitioners here at AesthetiCare, our world's leading clinic, and today I'm going to talk to you about HRT. What can hormone imbalance look like? So, we have hormone receptors throughout our bodies. Symptoms can range from all kinds of different things, and every woman is a little bit different. Some women may have one set of symptoms, another woman may have a totally separate set of symptoms. So, really making sure you're getting a comprehensive and individualized approach is super important. Some of the more common symptoms that I see are brain fog, abdominal weight gain, vaginal dryness. The classic are the hot flashes and night sweats. People will have sleep disturbances, mood changes, muscle loss, joint pain. So the list can go on, and it is really just depends on the person. So hormone imbalances can affect men too. Typically with men, we'll see mood changes, sleep disturbances, decreased muscle mass and strength, sexual dysfunction, low libido. So these symptoms are not just minor inconveniences, they affect how people live their lives. So what is HRT? So HRT is hormone replacement therapy. Generally, we use BHRT, so bioidentical hormone replacement therapy. So, chemically the same as what our body produces. There are synthetic hormones that we can use. We typically like to use the ones that are chemically the same as what our body produces. So, how does it help? So, as we age, and especially for women as we approach menopause, we become very symptomatic of having these hormone imbalances. Perimenopause is the phase before menopause. So, the average age of menopause is about 52, and it's just kind of this magic space and time where you don't have a period anymore for at least 1 year. So there's a whole, up to 10 years before menopause is called perimenopause. And so people tend to be very symptomatic in that stage, and then a little bit actually after menopause as well. So replacing some of those hormones can help balance the body and decrease the symptoms. There's estrogen, progesterone, and testosterone. Those are the three hormones that we replace. So estrogen typically is more your hot flashes, night sweats, can be brain fog, joint pain, that abdominal weight gain. Those tend to be more estrogen driven. Progesterone is really great for sleep disturbances, for mood changes, and testosterone is very great for mood. It's a helper hormone, so it can help with mood and sleep. It can sometimes help with hot flashes. It increases libido, sexual function. In terms of results, it really is dependent on the patient. The timing of when to start hormone replacement therapy varies person to person. Sometimes we'll be more symptom driven. Sometimes we'll look at symptoms and we'll also look at lab work and kind of balance the two and come up with a plan based on that. We also obviously want to make sure we're looking at personal history, other medications, could other things be causing these symptoms, make sure those are not the case, family history, etc. And so we can start hormone replacement therapy even in that perimenopause stage. You don't have to wait until you get to menopause to feel better. A lot of times in perimenopause, the fluctuations are so severe that people feel the worst during that time. So making sure we're being proactive. Obviously, we don't need to start it if you don't have any symptoms or if your levels look good, but that's something that we'll want to take a look at. And as we age, things will need to be adjusted. So it's not a set it and forget it. It's a very individualized, you have to stay on top of it, comprehensive approach. You can change the mode in which you replace the hormone. There's lots of different options. It just depends on the person, how they feel. One thing that works for some person may not work for the other person. So really just listening to the patient. So, what to expect from start to finish? So, when we first see a patient, we see them for a consultation. During the consultation with one of the nurse practitioners like me or with Dr. Carter, and we'll go through medical history, what medications the person is on, family history, and then their symptoms, how they're feeling, how long have they been having these symptoms, have they tried anything in the past that's worked or not worked. So we go through all those things. And then depending on the age of the patient and all their history, we'll recommend getting some lab work done. When we see you back for your lab review, and that's where we come up with your plan for your care, that's where if I'm sending in prescriptions, I'll send in the prescriptions and we'll go through instructions for how to do depending on what mode of replacement that we're using. And then we'll come up with kind of how we're going to follow up. So we want to make sure, again, very individualized. We want to make sure we're taking really good care of our patients. So we do follow up in an appropriate manner. So hormones can be delivered in many different ways. With estrogen, there's patches, there's creams, there's troches. So a troche is a little gelatin thing that you dissolve in between your cheek and your gum. Ideally, creams and troches are dosed twice daily. We also do the pellet procedure here. So the pellet is about the size of a grain of rice. We numb the skin locally just above the glute muscle, and we make a tiny incision and then use a little instrument to insert the pellet into the subcutaneous tissue, so the fatty tissue underneath the skin. And that is where it dissolves over usually about 3 to 4 months for women, and for men, testosterone pellets can last anywhere up to 6 months or so. Estrogen, there's a lot of different ways to replace. Progesterone is a very large molecule, so it's not absorbed as well if we put it in a cream or a troche. So ideally, we typically dose it orally. You take it at bedtime, it crosses the blood-brain barrier that way, and that is where it really affects sleep and mood. So testosterone can be replaced in a number of different ways as well. A cream, troche, the pellet procedure. Sometimes we'll do injections. So it just depends on the person. There's benefits and drawbacks to each way to replace. So it really is an individualized decision. So after treatment begins, usually people will start to feel better within a few weeks. We generally like to see people back around the 6-week mark, and that's where we'll run, depending on which hormone we're replacing, we'll recheck levels and make sure they're in a safe level and that the patient also is feeling the benefits from it. After that, it depends again on mode of replacement, but we'll see anywhere from, every 3 months to every 6 months. We see at least every 6 months typically. So hormone replacement therapy is very beneficial for symptom relief, but it's also very beneficial as a tool for longevity. There's a lot of, good data for protecting our hearts, protecting our brains. Estrogen protects our bones, it protects our vaginas. It's a great tool to use long term. There was this misconception for many years that there was kind of this magic window of 10 years where you could do hormone replacement therapy and then you had to stop. And that's been since debunked. So women can, and men too, can continue hormone therapy until the day they die, if they so choose. I do have patients even in their 80s that continue to use hormone replacement therapy. One thing I will say, it's really important. HRT can be life-changing, but it's really, really important to go to practitioners who know what they're doing. Nurse practitioners, physicians, ideally, physician assistants as well, because you need to be monitored. So we want to make sure that you're having symptom relief, but that your hormones aren't getting too high or that you're not having side effects. So it's very, very important to be monitored closely. To learn more about HRT, visit worldleadingclinics.com.